Last week in part 1 of talking about the experimental pharmaceutical treatment for long COVID called triple anticoagulant therapy, we reviewed the impact of that treatment on symptoms. Today in part 2, I want to talk about the molecular level effects that triple anticoagulant therapy had on microclots and platelet hyperactivation in long COVID patients. Triple anticoagulant therapy is made up of 3 drugs that target clotting in the body. 1 anticoagulant drug, apixaban, and 2 different platelet activation inhibitors, aspirin and clopidogrel, which each have a different mechanism of action. So let's look at the mechanisms of action of these drugs. Apixaban, the anticoagulant, inhibits factor Xa, which is a key enzyme in the coagulation cascade that forms clots. The first platelet activation inhibitor, aspirin, inhibits the COX-1 and COX-2 enzymes, as we've discussed in previous videos. The second platelet activation inhibitor, clopidogrel, inhibits the P2Y1 and P2Y12 receptors on the cell surface of the platelet. Together, these drugs help reduce the natural clot formation and prevent activated platelets from being sticky and binding to the clot as they form. So what effect did triple anticoagulant therapy have on the 91 long COVID patients in the study we're looking at? Triple anticoagulant therapy reversed the microclotting and platelet hyperactivation in all of the long COVID patients that were judged to be recovered. Remember that in this study, 80% of the patients were judged to be recovered based on improvement in their symptoms. This data shows that the molecular level markers for long COVID, microclotting and platelet hyperactivation, also resolved along with the long COVID symptoms. That's a clear win for the triple anticoagulant therapy. Unfortunately, the data also shows that microclotting and platelet hyperactivation were both still present in long COVID patients that did not recover after taking triple anticoagulant therapy. If you want to see a written summary of this information, including a link to the preprint of this study, check out my bio, click the link, and click the button to go to my Substack article. And if you want to hear more about experimental therapies for long COVID, including the solutions I'm working on, please join my email list. Just click the link in my bio and then click the Join My Email List button. I'll be talking about the solutions that I'm developing exclusively on my email list, so please sign up to hear about them. And as always, you can follow my research and give me feedback by leaving a comment, checking out my bio, and following me. Thanks, and see you next time.